Hi, Dr. Scott Freed, the doctor in the house. For those of you who don't know me, I'm an orthopedic hand surgeon, and I've been in practice for over 25 years. And something I found early on was that many patients don't need surgery. Now that sounds strange coming from a surgeon, I know, but I found over the course of time, pairing and working with our therapists, using splints and devices to rest the hand and wrist, but the proper type, not ones that put them in the wrong position, such as the cock-up splints, or ones that rigidly held a hand and an arm, causing people to use this abnormally, but rather splints and therapies that calm down inflammation, often gave the same, if not better, results than the surgeries we did. I'd like to take a moment or two to talk to you about ultrasound anatomy so you can understand what the body looks like inside. So over here we have a median nerve, and this is the nerve itself, this dark tube. And down here are those flexor tendons, the cables that move the fingers. Up here on top is where the ligament is, and that presses or compresses the nerve. And this white you see around the nerve is scar tissue formed around this nerve. And this is a very scarred median nerve. And down in here you see the dark and light streaking. This is a lot of tendinitis. On a transverse view, up top here on the palm is where the ligament is. This is that median nerve. And these are those flexor tendons, the cables that move the fingers. See how the nerve in this normal study can move around freely. It pops back and forth around and between the tendons, sliding under the ligament. On a long view, we see what happens after the scar is there. Watch what happens on this median nerve on the right-hand side. You see how when the fist is made, it disappears. Watch again. The hand is open. The nerve is okay. You can see it here. When the hand makes a fist, close, nerve is gone, open, the nerve comes back. When we have this swelling in the carpal tunnel, it continues to put pressure on the nerve and the median nerve in the carpal tunnel. That pressure sequentially over the course of time causes scarring around the nerve. We came up with a splint, a device. It's called the Miracle Splint. And you can move the hand and wrist in this splint. You can move your fingers. You can do that, but you are supported here in a wrist neutral position, not cocked back up. That allows healing. It allows comfort. It takes the pressure off in this area. At nighttime is a very important time to wear it. It's calming down that tendinitis and inflammation, and often can give enough relief just in of itself. Medical grade plastic you can see here, and it comes right inside the splint, and it's flexible. But even more than that, it's moldable. The whole splint goes in the microwave. Then you take it out and put the splint on, and it molds to your hand. These orthoplast pieces mold directly to your anatomy to give you a different type of healing, a calmer healing that fits you, specifically your anatomy. So take the time to understand, to take care of you, and I can help you heal many times without surgery.